I should start off by saying I'm really pleased, proud, thankful to be here, to be in a job that I would have designed if I was sufficiently insightful years ago. It's for me, having spent a career thus far at the intersection between engineering and medicine, this looks a whole lot like the convergence of a life's experience into an opportunity to take all of those tools and bring them to bear at one time. You know, Gary and Mary's passion and courage in putting this together is difficult to describe in terms of the what it takes to first do it, to vision it, and then to create it, and then to start populating it with people. There's a tremendous amount of work that's done there, and the overriding mission to take some of the cost out of healthcare so that healthcare can be affordable to all of those people who are now newly entered into the system is truly a remarkable goal, and it's also one that isn't just limited to the U.S. You know, Don talked about how we're approaching 20% of GDP spend in the U.S., and the best estimates from the Congressional Budget Office are that number is going to go up incessantly, and that the estimates are in 2082. Imagine this. They can look forward that far and say that by then we're going to be spending 35% of GDP on healthcare, and that's simply impossible. And we think about the challenge in the U.S., and then you start, as I've had the benefit to be able to do travel around the world, and you see that healthcare is under siege everywhere. And it's not just here where we spend much more than we should to get a product which is poorly distributed and yields less outcomes than we would like. But when you visit some of the less fortunate countries where they're struggling to do almost as good with much, much less, you appreciate that the opportunities for us to take what is a very ubiquitous technology in terms of cellular communication and finally give it the opportunity to impact health broadly is a remarkable opportunity. It's part of that recognition of the global challenge that gives me a great joy in describing the relationship that we are today announcing with the Carlos Slim Health Institute. I'm delighted that we have Dr. Tapia and Dr. Gallardo. Together, we are going to work to innovate and then validate technology solutions for the most vulnerable among us in terms of patients who are struggling with conditions where the healthcare system serves them so poorly that simply providing what looks like modest technology, when applied appropriately, can make dramatic differences. And one of the things that we're witnessing is that when countries are forced to provide healthcare solutions to their most needy at price points that work for their population, those solutions can rapidly move back into the United States and disrupt the healthcare system, which, as you already see, is both bloated and somehow inflamed. And so it's a direct joy for me to be able to introduce the good Dr. Tapia. Thank you so much for coming. Please.
Well, thank you very much. Really, it's an honor to be here, and really, I have to say that it's a privilege for us to join the West Wireless Health Institute. Let me say that it was just a few months ago that I had delighted the moment that we had dinner with Gary just a few months ago here in San Diego, and over a great glass of wine. And I think that was the inspiration to share our mission, the objectives of both institutes, and as Don mentioned, and as he was describing, we are really on the same track. So the nice part is that after that evening, we started moving, and today we are really without any bureaucratic paperwork or anything that would hold us back. We are on track. We are already in the design of one of the pioneering, I would say, technology, wireless technology that will change the health system around the follow-up and evaluation of pregnant women in Mexico, and in the near future it would be, I hope, in Central America with our new program that we have down all the way to Panama. And so I also want to acknowledge the great people around the engineering process, that we made a great team. Hector, which is our medical director, he oversees all the health projects. It's been a great pleasure to have all this thinking and brainstorming, so we're delighted to that. Let me give you a bit of a background of what the Carlos Slim Health Institute is. We started 3 years ago, even though Mr. Carlos Slim has been in philanthropy for more than 30 years. 3 years ago, he decided that he wanted to be more systematic around the innovation and implementation of new things around, and to really change and to intervene into the inequality of health services in Mexico and in the Latin America region. So we created, I was privileged to be invited by him to start up the institute and to really work around the areas of innovation, research, and to really come up with the design of around models that will first, as Don mentioned, come up with the innovation, with the validation of those models. And one of the platforms that we taught just from the scratch of the first lines that we started thinking around the Institute was the technology platform, and more specific around the wireless health technology based originally around the cellular phones. So that from 3 years ago, we were privileged to see the creation of the West Wireless Health Institute, and as has been mentioned today, it's really one of our main global partners that we are around the technology platform. We're centered around the maternal health innovation and models that can change the system, and those models can really have the evidence that can be translated into public policy. That's our mission. The other part is around chronic diseases, with it also matches what we are looking at, the reduction of cost in health services. Even though a country like Mexico, its investment around health is around 6.5% of the GNP, it has its points where it can be more efficient. And one of the areas that efficiency is really clear is around the use of technology in chronic diseases. Just to let you know that one of the main health systems in Mexico takes 10% of its budget just treating diabetic patients, which is really an amazing investment, and there's a lot of inefficiency around that. So we'll try to really make things around that to make it more a model and a system that works in a more cost-effective. The other part is that we are truly sure that we can also change the concept of the current model, medical model, which is centered around medical services, around disease. And we want to move more into the prevention component and to the empowerment of individuals. So that's the way that we're using also cellular phones to promote the concept of prevention and the empowerment of people and the involvement of people in their own health. So we have developed a number of applications already that they are being tested. They are in their piloting process with very good results around diabetes, around HIV patients, and also with the models with the lifestyle change, which we are also merging with very important firms in Mexico to come up with very, I would say, large-scale interventions in the country. So in general, it's really a great moment for us. I'm really, I would say that the calendar it's going to, in my calendar, is going to be two significant moments. This, that we are here, and that for the first time Mexico win France in soccer. So that's going to make the difference. There's no question. Thank you very much.